Okay, good afternoon and welcome to another interesting episode of the Real Talk Show. And of course, the time is 14 hours. You always see us on this screen when it's on Friday, when we come with different topics that we get to discuss. And of course, we talk about topics that are happening in our community, something that is real. No wonder we call it the Real Talk Show. Remember, this show is brought to you by the Youth Platform. And of course, this month we are on the Amplify Change campaign, and this is under this is also just under the Be Safe campaign, which is supported by the Amplify Change, and it's also under the Youth Community Advocacy Project. So under this project, we talk about a number of things that are affecting adolescents and young people in our community. And today is one of those days when we get to talk about some interesting things that are happening in our community that are kind of affecting us. And we just bring it here so that we can talk about it and we see how best we can just work around it. Well, I know you have seen that we have beautiful faces on the screen, just as always. We bring you different people with different backgrounds, different experiences, and of course, different information that they would like to share with us. Without wasting so much time and without talking too much, this week we are looking at contraceptives and disability, the inequalities that we have around the access to contraceptives when it comes to persons living with or persons with disability. What is it that we can do? What challenges do they get to face? And how best can we just work around that? So I have guests on the screen, just as you've seen. I'm not going to introduce them because I might not do justice to the introduction, but instead I'm going to allow them to just introduce themselves. They're going to tell us their name and where they're coming from so that we can know who exactly we're talking to today. I will go with the first one can be Sarah. Sarah, you can go ahead and introduce yourself.
Okay, good afternoon, everyone. My name is Chihinga Sarah from Kwame Nkrumah University in Kabwe.
Thank you so much for that introduction, Sarah. Dorcas, you can go ahead.
Good afternoon, everyone. My name is Mabwe Dorcas, a registered nurse midwife and the adolescent focal point person for Mahatma Gandhi Adolescent Youth Friendly Space.
Great. Thank you so very much for those introductions. And of course, my favorite guy on the show, somebody who we don't get to hear his voice, but we just see him do the signs for us. This is none other than John Shulu. John Shulu has been with us for some time. He's our sign language interpreter to just ensure that our fellow adolescents and young people out there are able to get what we're saying. At least they can understand whatever that is happening through John. Thank you so very much for joining us on this show. So we are diving right into the conversation of the day. And I honestly feel like this is going to be a very interesting show because we're going to talk about things that really happen in our communities and things that we perceive to be normal, but in the actual sense, they are not normal. And I'm glad that we have an adolescent focal point person who has at least some experiences when it comes to just administering or maybe providing services to our fellow adolescents and young people with disabilities. And of course, we have Sarah who's going to share some experiences of something that has maybe happened in that community, something that she has experienced, or something that she just witnessed at the end of the day. So these are the people that we're going to have on the show. And of course, we are not leaving out my favorite people. You know, on the show, I have different favorite people, but I also have another favorite, a set of favorite people. And these are my online community. My online community does not remain. Please, this show is yours, and you make it possible for us to have different topics each and every time we come here. So tell us where you're watching us from and what you know, and how best we can ensure that our fellow young people are able to access contraceptives and other sexual reproductive health services without being judged or without restrictions. The comment section is yours. So we're diving right into the conversation of the day, and I would like to start with our adolescent focal point person, Dorcas. We are looking at contraceptives today and access to contraceptives and disability. Kindly help us understand what contraceptives are and which contraceptive methods are available in health facilities.
Okay, thank you so much, Margaret. So when we talk about contraceptives, we're simply talking about methods, or rather medicine, that will help one from preventing one from becoming pregnant. So there are quite a number of contraceptives that are available in these health facilities, and I'll group them into two. First ones, we have the short-acting, or rather the short-term contraceptives, and we also have the long-term contraceptives. So under the short-term contraceptives, we have the barrier methods, which are condoms, and I'm sure all of you know about condoms, and some of us, or maybe some of you, haven't seen them or used them before. And we also have pills, the emergency contraceptive pills, and we also have the oral contraceptive pills, and we also have injectables. Under injectables, we have for 2 months, and we also have for 3 months. I'm sure some of you are so confident with this family planning. You've heard of people talk about Depo-Provera or Cyana Press. So those are injectable methods that we have. And we also have implants. These implants we have for 2 years, and we have for 3 years, and we also have for 5 years. The common one is Jadel. And we also have the long term. Under the long term, we have the IUCD. These IUCDs, they're commonly known as the loop out there. And we also have the permanent methods, like where we do vasectomy. So basically, those are the methods that are being offered in the health facilities.
Okay, thank you so much for that, Dorcas. I just want to interrupt you while you're talking. Maybe if you can move your phone a little bit so that your video is not cut.
Oh, okay.
A little bit backwards.
Is it better?
Yes,
Oh, I get
thank
it.
you. Thank you.
Oh, all right.
Okay, thank you so much, Dorcas, for the explanation. I feel like you've given us an overview of what contraceptives really are and the different types of contraceptives that we have. And of course, I believe that these contraceptives, they are available in different health facilities that we have around here. And looking at the contraceptives that you have mentioned, I can again attest to the fact that each person has got the right to choose which contraceptive really works best for them. That's why we have a number of them. Thank you so very much for that breakdown. So I'm going back to Sarah. So Sarah, I would like you to just help us understand, or maybe tell us what access to contraceptives really mean to you as a person or as a young person, and how important it is.
What I think the meaning of access to contraceptive is, it is being able to get them from health facilities when you want, like when I want to, for example, when I want to go and get condoms, or I want to prevent myself from pregnancy, I'm able to go there without anyone looking down on me or without limitations for me. And it is important because it prevents someone from unwanted pregnancies, especially to us young youths who are still in schools.
Mhm. Thank you so much for that, Sarah. And of course, contraceptives are a very important thing to young people, especially for those in school. If a young person gets to find that they're sexually active, I feel like a contraceptive would be something that could serve them at the end of the day to still be in school. Thank you so much for that explanation, Dorcas. So I'm still going back to Dorcas. So Dorcas should give us an overview of what contraceptives really are and the different types of contraceptives that we have in these different health facilities. But how accessible are these contraceptives and maybe just some other sexual reproductive health services when it comes to, I know to some people they are very easy to access, but we are looking at disability, a person living with a disability. How accessible are these contraceptives and other services?
Okay, so these contraceptives that we are talking about and the sexual reproductive health services are very much accessible to everyone. Whether someone is having a disability or without a disability, they are easily accessible. Yeah. So there's
Okay.
no limitation to say if somebody is having a disability, they can't access these services. No. So whether someone has a disability or no disability, the access is just the same.
Okay, great. So when we talk about accessibility, you've mentioned that they they are for everyone. Whether somebody has
Mhm.
a disability or somebody does not have a disability. But you being a focal point person at Mahatma Gandhi and maybe you being interactive with so many people, do you think you get to have adolescents and young people get to come to the clinic to just access these services? And if you get
Yes,
to have such
we do.
people coming to access, how do you help them at the end of the day, looking at different types of disabilities that we have around?
Okay. So that one is dependent on the type of disability that someone is having. And when we're giving health education, we make sure that we educate them so that they know all the types of contraceptives that are available, and we help them make an informed decision. So information will be delivered, and it's up to that person to choose which one they feel is okay for them.
Mm,
Yeah.
okay. Thank you so much, Dorcas. I like the fact that you are mentioning to say adolescents, whether with a disability or without a disability, they all have the right to access the services. And of course, services are made available to them whenever they get to come to the health facility to just access them. So I'm going back to Sarah. So Dorcas has mentioned to say these services are available in these health facilities. And I would like to get your view as a young person from your perspective. Do you think persons with disabilities have access to these contraceptives and the right information?
Um, yes, I think they have access to information, but it's not enough. Why I'm saying so, it's because especially those people with living with disabilities who are in villages, they have little or no information about contraceptives. So you find that they are they're just having pregnancies here and there because they lack information, and the society is looking at them in a different way, especially in the villages, because information is not that taught or told to them.
Yeah, thank you so much. I feel like that's another gap that we have when it comes to contraceptives and um, persons living with a disability. We might say that information is there and the contraceptives are made available to them, but then the actual thing is, how best are we trying to just ensure that information reaches the places where we can not even think about. Us who are in these communities where we have access to internet, access to youth-friendly spaces, we are lucky because we are able to receive this information. But for our fellow young people in villages, just as Sarah has mentioned, it's a very difficult thing. And you would be surprised to say some of them, they don't even know what a contraceptive is and how best they can just prevent themselves against pregnancy, HIV, or STIs. So I think that's another gap that we need to close when it comes to access to contraceptives and disability. So to our community, our online community, of course, whoever is watching, whoever is listening, and whoever is trying to participate, please tell us, how best do you think we can work on the issue of just ensuring that information reaches each and every particular young person out there when it comes to accessing these contraceptives that we're talking about and other sexual and reproductive health services? Thank you so much for that, Sarah. I'm going to Dorcas. So, no, before I go to Dorcas, I would still want Sarah to say something. So, Sarah, kindly enlighten us on the challenges that adolescents and young people with disabilities face when it comes to accessing contraceptives in these different health facilities.
I didn't hear your question quite well.
Okay, so what challenges do persons with disabilities face when they are trying to access contraceptives and other sexual reproductive health services?
Okay, the first challenge I would say there is no enough information about contraceptives to them. The other challenge is that the fear of how the other people will look at them. For example, if I want to go and access contraceptives in a health facility, I will fear to say, the people, yeah, even if they are just looking at me, I would just say, why are they staring at me like that? They are thinking of something else, or do they think that also I also don't have access to this, or I can't do this, or what? So there is that just a natural fear in persons with disability to access contraceptives because of how the society will look at them. So it's a challenge on it. So
Yeah.
I think we need more sensitization to people, to just people to be informed or educated that everyone has access to these contraceptives, so that that fear will be removed in people's minds. I mean, those with disabilities.
Mm.
Yes.
Thank you. Thank you for that, sir. Yeah, and that's a very true statement, or rather, something that is happening in our communities. Like, it's not like our fellow young people with disabilities do not want to get these contraceptives or just access them at the end of the day, but it's because of the environment where they are and the fear that they have in them. Just even us, when it comes to accessing these contraceptives from different health facilities, we get to have some fear in us, like, what if somebody sees me, what if my neighbor is here and sees me getting a contraceptive? What's going to happen? What if my aunt is here? We get to have so many things that gets to go around in our minds. And I can also feel it, that the same way we feel is the same way our other friends feel, especially when they're even being looked at in a certain way. I think Sister Dorcas can attest to the fact that we have a number of adolescents and young people are so much afraid to access these services because
Yeah.
of because of maybe the environment, just the environment at the health facility. Like, people are looking at you. You are going to get
Mm-hmm.
family planning. You'll be like, oh, tell they know what I'm going to be doing. Those are the things that we need
Yeah.
to go through. Thank you so much for that, Sarah. So I'm going to go riding on Sarah's answer on the challenges that adolescents gets to face when it comes to accessing these services. So, Dorcas, how prepared are you as a healthcare provider when it comes to just ensuring that you support a young person with a disability who has come to access these services, how do you support them in ensuring that they don't feel scared, or maybe in ensuring that they get to choose the right contraceptive that is going to work for them?
Okay, yeah. So actually, what Sarah said is true. There's that thing of member the community being judgmental, especially to our friends having disabilities. Yeah, so on that one, as a facility, what we've done is we've placed an adolescent at all entry points to help triage their fellow adolescents with or without a disability. So when they see an adolescent walk in or be on the line, we are trying to triage and attend to them in the shortest possible time, because we understand that if we triage them and we provide the services to them as quickly as possible, it will encourage them to even come back the next time. Yes. And on the accessibility of contraceptives, we've come up with days, looking at the fact that most of the adolescents are school-going girls and boys. So we've come up with a day, which is Friday. That one is specifically for adolescents. So even when they are walking in, they won't be mixed with the adults. So nothing like, no, somebody is going to see me, someone is going to judge me. And we ensured that it's a private room where no one is going to suspect them or see them as they walk in. So we've just made it like away from the happenings of the poor facilities, so that they feel safe and they're easily coming to access these services. Yep.
Interesting. Interesting. I like the fact that I don't know if all the health facilities that are doing this by having a young person who is like just targeting adolescents who are coming to the health facility and taking them to the right places. I don't know if it's all the facilities that are doing this, but this is a very good idea in ensuring that even adolescents themselves, they feel safe. It feels so much safe when you're talking to somebody of your age and like talking to someone who is older than you. At the end of the day, you're going to find that an adolescent will say, this person was judgmental towards me. This person
Yeah.
was not able to help me because of the age, maybe, and whatnot. But I like the fact that we have adolescents who are just placed at a health facility to help bring adolescents and just take them to the right places where they're supposed to be. So, still on you, Dorcas, you've spoken about the strategy that is being used to just get adolescents and the young people who are kind of coming to the health facility. So, what measures are in place to ensure that there is effective communication with persons who are coming to access these services from health facilities? Because I know we can't just say that we have a same group of young people with the same disability that gets to come and access the services. And obviously, we get to have different disabilities or different persons with disabilities that get to have access these services. But then on your end as a healthcare provider, what measures have you put in place to ensure that there is effective communication when you receive such young people?
Okay. So one of the measures that we put in place is on communication. Yeah. So we receive people with disabilities, with different disabilities, and depending on the type of disability that someone is having, we try to be simple in our language so that they understand what we're trying to show them with the use of visual aids. Yeah, so we've come up for contraceptives. We've come up with the visual aids for all the types of family planning methods, so that they're able to visualize what we're telling them. With the help of that visual aid, we're able to show them and they're able to understand. So for those with, for example, they're not able to talk or they're using sign language. Unfortunately, we don't have anybody trained in sign language, but we try. we try. Yeah, we try. Yeah.
Okay. So I feel like now this is another gap that we have, and of course, this is something that we need to look at when it comes to just ensuring that even our friends who are using sign language, they are included, and
Exactly.
they can be able to access these services. And I think at the health facility, at least there should be one person or two people at least who are just conversant with sign language, and they are able to just communicate with clients who come and they want to access whatever services and they're using sign language. Thank you so much, Dorcas. I'm going to Sarah. Sarah, I haven't forgotten about you. I'm still here. Um, so we've spoken about access to contraceptives and disability, and of course some of the barriers that we get to have, and just the misconception and the myths that we have around accessing contraceptives, and which is kind of connecting to disability. So there's a common misconception that a person living with a disability cannot be sexually active. Just as you mentioned, to say when you go to the health facility and you find that people are looking at you in a certain way because you have a disability and because you want to access a contraceptive at the end of the day. So now, looking at some of the myths that we have in our communities, people believe that a person with a disability cannot be sexually active. How does this belief affect your sexual and reproductive health and just the ability of young people to access contraceptives? Your mic is muted, Sarah.
Am I? Hello?
Yes, we can hear you now.
Can you hear me now?
Yes.
Yes, I was saying that myself, like I have had it in my case. I've experienced it. People in the community where my family they ask my mother a boyfriend. Those questions, I don't know how people look. It's from will say what makes them think that me boyfriend or me I can't be sexually active. Why is it? Because I look different from them or what? So it's very, very traumatizing.
Okay, Sarah, at some point we lost you. The network was kind of breaking, so kindly just repeat your answer so that we can get you clearly.
I was saying that it affects our mental health
Mm.
because in society the people are busy asking questions. Can she have a boyfriend? Those such questions are being asked to our family members, not directly to us. So when we hear such beliefs, they are very traumatizing. So in the
Mm-hmm.
end, you live a life, a stressful life, and you are just there wondering, am I not a human being as well or not? So it affects our mental health.
Mm.
Yes.
Thank you so much for that, Sarah. And that's really true. You know, something that really bothers me is why is it that the community or maybe the people around us think our fellow adolescents and young people with a disability are so different from any other person who doesn't have a disability? That's one question that I think this goes to our viewers as well. Whoever is listening, whoever is watching, and whoever is just participating to this show. The question is, what makes you think a person with a disability is any different from any other person without a disability? Because if I do not have a disability and I'm sexually active, it doesn't mean Sarah cannot be sexually active. It doesn't mean Sarah cannot have a boyfriend. We're just one and the same. But then maybe because of how we were just biologically made, that's what makes us different. And of course, accessing contraceptives should not just be restricted to people without a disability. Even a person with a disability can access the same contraceptive that I'm accessing. That's just how it's supposed to be. Anyways, let's get back right into the conversation before we get carried away and start pointing fingers at some people. So I'm going back to Dorcas. Sarah has mentioned some of the misconceptions and the myths that we just have around accessing contraceptives and disability. But then you being a focal point person who deals with adolescents, of course, and somebody who at some times or maybe always administers these services to different young people. How do you ensure that there's, I know you mentioned something, you mentioned in your preamble, you mentioned something that is relating to this, but I would like you to just make us understand more or go a little bit deep when it comes to the way you ensure that there is privacy, confidentiality, and informed consent when it comes to accessing contraceptives and other sexual reproductive health services to persons with a disability.
Okay, so thank you, Margaret. So, as you all may be aware, we all have human rights, whether you have a disability or without a disability. Everyone is entitled to human rights. And as family planning providers, you're supposed to ensure that there's autonomy and the patient makes an informed decision. So, whether someone is having a disability or not, they're supposed to make their own informed decisions. And so how we ensure that that is done is by delivering health education. So what makes people make wrong decisions sometimes is lack of information about certain methods. So what we do is we really ensure that they understand, that they really understand all the methods. So one thing I've noticed dealing with adolescents is that you need to be a little bit patient with them, because you find that sometimes others will come seeking services and they've read about them, they already have information about them, and others will come with no information. So if you are in a rush, you make them make decisions that they didn't want to make. So you have to be very patient with them and give them the enough time that they need to think about everything and come up with an informed decision. Yeah.
Great. Thank you so much for that, Dorcas. Talking about informed decision and just ensuring that you offer sexual reproductive health information to our fellow young people with a disability, it's now takes me to something that really happens. It happens in most communities. It really does happen. And I don't know, you being a focal point person and somebody who provides these services, maybe you might have experienced it. Now, in a situation where a family or a caregiver is kind of trying to make a decision for a client or a person living with a disability on what contraceptive to use, how do you get to handle such situations?
Okay. Yeah. So that happens. But one thing that you need to understand is, in as much as you are a provider for that service, you're not allowed to make a decision for your clients. Yeah. So whether, maybe depending on the type of disability that someone is having, that what I believe is, whether with a disability or without a disability, someone is able to make an informed decision. So those parents or caregivers who come to the health facilities and they really insist on making a decision for that person they brought in, we really we explain to them so that they understand. And we make sure that, for example, if someone is having an intellectual disability, you just have to be patient with them, use simple language that they can understand, and finally be able to make the decision on their own. But supporters or caregivers making decisions on behalf of someone, no, that one is not allowed unless the disability is yeah.
Yeah, that's very true. You know, there are times maybe some adolescents, especially with the fact that they're vulnerable, they can't really make decisions on their own. They can't really speak. They can't really choose at the end of the day. And you find that a contraceptive is chosen for them on their behalf, like a family member or caregiver, just to choose the contraceptive for them. But then we don't have an idea of how that contraceptive is going to work because contraceptives work in different ways depending on the body and depending on the person.
Yes.
So now, if somebody chooses the contraceptive on my behalf, what if it doesn't work? So I think that's why we have an important aspect of having you as a healthcare provider who is there to just advise and of course provide accurate information on how best contraceptives work for different people. Thank you so much for that, Dorcas. I'm going to Sarah. So Sarah, um, we've spoken about the myths and the misconception that we have in the community and how it affects us. So we have a number of adolescents and young people with disability who get to face different challenges like there's discrimination, there's stigma, there's judgment when it comes to seeking these contraceptives. How do you think, or what do you think could be the effect or the dangers of judging or stigmatizing adolescents who try to access services?
I lost you at some point. I wasn't getting what you were saying.
Okay, so we have a lot of stigma. Is Dorcas still with us? Okay, I think Dorcas. Oh, Sarah is still she's having some challenges with her network. So I'm going to Dorcas. Dorcas, I'm going to throw this question to you as a healthcare provider. What do you think could be the dangers of stigmatizing and just discriminating adolescents who are trying to access services of contraceptives?
Okay, so one of the dangers is that they will shun away from having access to the coming to seek these contraceptive methods that we are talking about. And these are the adolescents out there that you find that they've fallen pregnant because not that they didn't know how to prevent themselves from preventing that pregnancy, but because of the community myths and misconceptions, they stayed at home and instead of coming to the health facility to seek these services that we're talking about.
That's very true. Very true. I think we have so many effects or dangers of discriminating or just stigmatizing adolescents who try to access services. Because if there's so much discrimination, it can be in the community, it can be at the health facility, it can be in a family. If we have so much discrimination in there, you're going to find that a young person is not going to access a service. And at the end of the day, they will engage themselves in unsafe practices. And at the end of it, you get to find that cases and cases of different health issues are keeping on to raise because of the same. Thank you so much for that, Doc. Sarah, can you hear me?
Yes.
Okay, great. So, Sarah, I know we've highlighted a number of things, and we are kind of running out of time or have to start winding up. But I would like you to just tell us something like what changes would you like to see? It can be in the community, in the health facility, in your family or families out there. What change would you like to see to just ensure that we get to have an improvement when it comes to accessing contraceptives, especially for persons with the disability?
The changes that I would like to say is that first of all, information. I would like to see that most people living with disabilities have more information about contraceptive so that they get to choose for what is best for them, and also maybe sensitization and education to families and people in the society. More of it is needed in the society so that that fear of people living with disabilities in accessing contraceptives is removed in them so that they'll be able to be accessing it freely without them feeling somehow or them being seen that they are being neglected or uh, discriminated. That's the most things that I want to see so that everyone will keep healthy, and also the issue of unwanted pregnancies and also STIs are reduced in the society, because if they don't lack information, the same thing will be happening throughout.
Yeah. Yeah. Thank you so much for that, Sarah. I think the first thing that we should be looking at should be access to information and how informed people are when it comes to contraceptives, and just the access and the processes that each person has to go through before they access these services. So, Sarah, you've mentioned that we need communities and the families to be sensitized and to give to have information, the accurate information on the access to contraceptives. So now when they have the information that we want them to have, how best would you like them to support you at the end of the day?
I would like to see the people around me, my family members, they are able to encourage me on how to take care of myself or on how to make informed decisions when it comes to contraceptive.
Mm, great.
Like they let me choose the method of contraceptives that I want, or maybe if I don't want to access it, no one should force me to say no, just go to the hospital and do this or what. At least they are able to support me in a way that I feel uh, free and the way that I feel safe.
Mm, that's
Yes.
true. That's true. If our family members, if our community members, and of course other people have the right and accurate information about the importance of accessing contraceptives and the importance of just having each and every particular person accessing contraceptives, it doesn't matter how you are, if you have a disability or not. If we have so many people just understand that we are one, and whatever that any other person can go through is the other thing, is the same as something that the other person can go through. In this regard, I think we can have a number of people who are able to just access these contraceptives that we're talking about without challenges. And of course, Dorcas will be having a number of young people on her door just trying to access these services, because the community is no longer judging them. The community is no longer pointing fingers at them. So it's all starts from information, enough accurate information to be made available so that people can know about it all. Thank you so much for that, Sarah. Dorcas, so we have spoken about a number of things. We have spoken about the misconceptions, the challenges, especially you healthcare providers that you get to face. For example, you mentioned that you get to have a challenge when it comes to um, maybe interpreting somebody who has come to access contraceptives, but then you don't have anyone um, to do sign language and to just help in terms of communication with that person. So now, what major challenges do you get to, apart from that, what major challenges do you get to face as a healthcare provider in delivering inclusive contraceptive services to adolescents and young people with a disability?
Okay, so I think one of the major challenges is lack of no one with sign language interpretation and also braille materials interpretation, because you find that maybe majority of them that are coming, they'll need somebody who's able to interpret what they're saying through sign language. And I think that's the biggest challenge that we have on our end. But where service
Mm,
delivery is concerned, we're okay, just that communication barriers.
mm.
Mhm.
Thank you so much. So I feel like this goes again to information, because if you're unable to communicate with a young person who wants a contraceptive, that means there's a gap in communication. You cannot communicate with that person, which is a challenge. Thank
Yeah.
you so very much for that. So as a healthcare provider and as an adolescent focused person, what commitments or action can other healthcare facilities or adolescent focal point persons, healthcare providers can check to reduce inequalities and just improve access to quality contraceptive services and other sexual reproductive health services for adolescents and young people with disabilities?
Okay, so the first thing that we've come up with is we conduct outreach where we do community sensitization and we go with the adolescents themselves, because we believe that if they hear it from their fellow adolescents, it's easy for them to come and access these services. So we do that twice in a month. Yeah, where all adolescents, those who are available, we go with them in the community and we get to sensitize them on the importance of using contraceptives. And also at our facility, I think we've trained a number of young people, adolescents, who deal with the adolescents themselves, because we believe that they're able to express themselves if they're talking to somebody of their age. They don't feel judged and whatnot. Yeah, so uh, we've trained quite a number of young adolescents. And we also encourage healthcare providers, whether they're adolescents or not, as they're dealing with adolescents, whether an adolescent has a disability or not, to include the disability inclusive health care service. So every time when we see these adolescents, we keep in mind to say we are dealing with a very sensitive age group and we need to be as patient as possible. Yeah.
Mm. Thank you so much for that, Dorcas. And I hope we have a healthcare provider who has been listening to this show. If not, and you know the healthcare provider that would like to listen to this show and just learn one or two things on how best they can handle adolescents and young people with disabilities, we can tag them into the comment section so that they can come and watch, and just tag them and write a short message for them to say, watch this show. So that we can learn one or two things, especially when it comes to handling adolescents and young people with disabilities. Thank you so very much. Looking at time, we've run out of time, and of course, we have to wrap up the show. And to our online community, we don't forget about you. You are amazing people, and you make this show possible by ensuring that you're watching and you're just participating by telling us where you're watching from and what you think about the topic of discussion. You can keep your conversations going in the comment section, and you'll be able to respond to some of the questions and some of the concerns that are raised in the comment section. For now, we are saying thank you so very much for your participation. I want to say thank you to my amazing guests. You've been wonderful and you've shared insights of what exactly happens on the ground and just how best we can just ensure that adolescents and young people with disabilities are not left behind. Remember, disability is not inability. A person with a disability is not any different from a person without a disability. The same way you can treat the other person is the same way you have to treat the other person. If I want a contraceptive and another person with a disability wants a contraceptive, please treat them as one. Let them access the contraceptive that they need, and ensure that we just prevent and put an end to these diseases that we're having, the teenage pregnancies that we're having around, and of course, other sexual reproductive health related issues. We can do that by starting now. Let's end the stigma and break the silence. Let us not be the reason why our fellow young people are facing these challenges, and in a situation where fellow young people are unable to just access contraceptives because of what we say to them or how we look at them. Thank you so very much again to my amazing guests for this amazing time you spent with us to just highlight more on what the topic is all about, and how best we can just look at these issues in our communities. And of course, I want to say thank you to John Shulu for always being here to just ensure that the show is inclusive to each and every particular person out there who is able to participate and just see what is happening on the show. Thank you so much, John, for fighting with the air today. Thank you so very much for making time and just being available to at least ensure that the show is inclusive to everybody else there. And to our online community, of course, thank you so very much for your participation. We see you, we hear you, and we are here to respond and just ensure that we note down all those concerns that you get to raise in the comment section. Thank you so very much. See you all next week with different people. And of course, I'm going to be with John and with a different topic and different guests, of course. Don't miss next week, Friday. Again, see you all. Bye-bye.